Here we are in the beautiful outdoors of Melbourne in Australia, because Nordic walking is practiced outdoors. Once you have learned the technique, it's a free activity you can do anywhere once you have a patch of outdoors. My name is Laurence Westcott. I'm a myotherapist with a special interest in the rehabilitation of the shoulder after breast cancer. I also trained instructor in Nordic walking, and I work from the Mornington Peninsula at two-base myotherapy. With treatment for breast cancer, your posture will probably have changed with limitation of movement and shoulder and neck pain. With scar tissue after surgery and radiotherapy, the shoulder will have rolled in, the shoulder blade will have come forward and up, the head, the mid-back will have rounded, the head will be pushed forward, and the chin up, shortening the back of your neck. I'm making it worse than it is for the demonstration. If we look below the shoulder, the rib cage will have tilted towards the ground, the abdominal wall will have slackened and shortened. How can correct technique in Nordic walking can help you regain a better posture, therefore taking the pain in your shoulder, neck, mid-back. As I start putting weight onto the ground through the pole, the arm, the shoulder will open up again. Gently to start, and more pronounced as the body allows it. With the shoulder opening up again, the shoulder blade will glide down and towards the spine. The head will come up, bit above the shoulders again, chin tucked, and long neck again. So it's shoulder open, shoulder blade down and towards the spine, long neck. If we look below the shoulder, the rib cage will lift up from the ground, the abdominal wall will lengthen again, especially important if there has been an abdominal flap reconstruction, and the abdominal will strengthen again. With side effect of chemotherapy, you may suffer of numbness in your feet, which will compromise your balance and your confidence. Walking with flat feet, small step. Adding the pole will make you regain confidence in your balance, which will allow you to stride again with longer step, which allows you to rotate your body compared to the small step, no rotation, longer stride. You can see how the torso rotates over my hips. That will make the core muscles work. Open up your posture even more. And will even make you smile. With better posture, we improve the efficiency of our breathing as the rib cage is higher up, away from our pelvic. The lungs can open up more. We increase the thoracic abdominal pumping action of the lymphatic system, which in turn can help combat lymphedema of the arm. And now, listen to Patrick from Nordic Academy, the Nordic walking guru who has trained me, who will talk more about Nordic walking.
Hi, my name is Patrick Belcher. I run Nordic Academy, and as such, we train health and fitness professionals to become qualified Nordic walking providers. The correct technique is vital to gain the benefits that Nordic walking claims. Nordic walking has a wide range of benefits, ranging from assistance right through to a fitness workout. When you apply pressure onto the poles, you take pressure off the lower limbs and off the lower back. At the same time, you engage your upper body. The better your technique, the more you gain. The better your technique, the more emphasis is on the overall body workout. The technique is relatively simple, but it's like riding a bike. It requires practice. When your right leg is in front, your left arm is in front, and vice versa. The movement comes from the shoulder, not from the elbow. When your right leg is in front, your left arm is in front, and vice versa. With long relaxed arms, the movement comes from the shoulder, not from the elbow. You apply pressure through the wrist strap, propel your body forward, and you end up with the pole being behind the body. And you can see from my posture that this is really beneficial for your upper body. You promote an upright posture. You move back, you use your shoulder and neck muscle, your rhomboids and deltoids, and that is the real benefit of Nordic walking. Yes, it provides assistance by using poles and helping with balance and helping with taking weight load off, but it is more than that. It is an upper body workout as well. You are more flexible and you are more mobile, and you keep that if you use Nordic walking in a certain way, in the best way possible. The better the technique, the more the person gains from Nordic walking. Practice is key. I can tell you in 5 minutes how Nordic walking should be done. It's a matter of the body to adapt and to get into that rhythm. And therefore it is very important that health professionals are properly qualified, that they get an insight into Nordic walking and not just do, oh, these are the steps. That's what you do. Walking is very adaptable. Anyone can benefit from Nordic walking. My first question when people come and ask about Nordic walking is, why would you want to do Nordic walking? If it's for somebody that had breast cancer surgery, I use Nordic walking in a different way than if somebody says, I want to use poles for trail running. In any case, it's important that the technique is adapted to the aim of the person. One way to maintain the standard is that we only train health and fitness professionals to ensure that with their background and expertise in their specific fields and with the training for Nordic walking, they can deliver a holistic and wholesome exercise for all of their clients or patients, whether it's in rehabilitation, whether it's in chronic disease management, or whether it's just as a way to lose weight, or as a total body fitness exercise. At Nordic Academy, we're very happy to assist you and to get you going to use Nordic walking for your clients and yourself.